I'm Dr. Richard Downs with Sleep Balance Academy. I'm going to introduce you a quick program, an introduction to the SDR program, the Sleep Diagnose and Refer program for sleep medicine and chiropractic care. And I'm going to go ahead and show you my screen right now, and we'll get right to it. Okay, this is called a telehealth portal, and it's custom made for your practice if you'd like that branding for yourself. And we're using this with the Sleep Diagnose and Refer program that Dr. Shane Smith and I will be helping you implement in your practices. This particular piece of the SDR puzzle is extremely important to your success, and it's not just about the sleep program, but you can use it in general chiropractic care for many different applications. So let's go to our next slide here. What is In-Hand Health Portal? You actually are placing your office real estate on your patient's phone. Think about that. It's not just a telehealth portal. It's a patient prescription, task, motivational, and reporting program. It can be branded for your office. It can be customized for whatever you want patients to do. It can be a tool for yourself to become accountable to a coach like me, so I can use it to coach you. You can set personal goals for yourself, and you can bill through it. You can also have a concierge program that's for members of your patient base that are special. Now, chiropractic applications can even be more. You're going to have to consider the value of the reactivation programs for your patient base, the value of follow-up marketing campaigns, how it can be used for that, the value of internal marketing and newsletters, the value of freeing up treatment room time for more productive procedures, the value of membership fees to actually have a patient subscribe to this program through you, the value of sleep monitoring and sleep delegation of that monitoring, the value of monitoring and customizing at-home healthcare, which could include anything. And for example, sleep programs, exercise programs, weight loss programs, and even being a request for coaching yourself. Let's explore just one of the problems that we're going to address that practices need to have help with. Now, these statistics are based on a dental practices, 2,500 dental practices that were surveyed. In this particular survey, they found this: 60% of patients are unscheduled. And I think that's pretty true. I'm a retired dentist, but I think 50 to 60% of patients do not go to the dentist regularly. 45% of patients are due or late. 15% either cancel or miss their appointments. Over 300,000 are off their recare due to COVID, and that adds up to about $64 million in lost revenue. This isn't done in a survey, like I said, of 2,500 practices. And here's another statistic that's interesting. Pre-COVID, 52% were unscheduled, and after COVID, 58%. Continued. On the missed and canceled patients, pre-COVID were 7%, and now it's 18%. Due or late patients, pre-COVID 33%, and now it's 38%. Everything has gotten worse since COVID. So this was again done on, there were 300,000 off the schedule in this 2,500 practice survey. Let's run the numbers. If you engage one patient to reactivate, that is $950 in a dental practice. I don't know what they are in chiropractic, but I can tell you that I think that's a fair figure for you guys as well, you guys and gals. If you reactivate 1 per month, that is a 10,000 per year more income. If you reactivate 10 per month, that's 100,000. And again, some of you might even charge, might even do 20 per month. It's hard to tell. I would think that you could easily reactivate 20 to 25 per month. It's not hard to do. There are plenty of systems to email, text, and call patients. So what's holding up most practices? Well, this survey said that the problem was redlining, and I'll explain what redlining is. Redlining, many do not have the staff, the time, or the space to see new patients anytime they want to. You need a way to make room for your reactivated and new patients without the need for adding staff. When your staff start using in-hand health with your patients, you can cut down on unnecessary office visits, freeing up staff time and treatment room time. You can spend more time evaluating and pre-evaluating appointments, and this needs to happen up front. Pre-qualifying people is a big deal, and we all know that. Having your patient rooms be productive with the time that you spend there is a big deal. There are procedures that can be done remotely and would be more valuably done outside the practice than in the practice. Also, you would have a need for less marketing for new patients. It's a lot easier to bring an existing patient into your practice than it is to market for new patients. It's less expensive too. Now, the features of In-Hand Health Medicine Portal, I'm going to show you those. The desktop admin software and the mobile phone apps. There are 2 mobile phone apps, the admin app and the patient app. So now I'm going to show you my desktop. Hold on just a moment. Okay, so here is the desktop app, okay? Over here, you'll see the libraries folder. The libraries, in the library, it's just a holding pen for different things that you might want to use in the different prescriptions that you give people. You might have, it's just a place where you put all your videos, your documents that you want people to read, places where you want to show them how to use equipment or instruments. It's all right there. And so you can explain to your patients. And when you do, you just go grab them out of this library and you put them in the prescriptions that you're going to be doing. Now, if you look at my console here, you'll see the Sleep Balance Academy. And if I go down to the treatment templates, you'll see that I have 2 of them here, okay? I have one for coaching chiropractors and another one for Sleep Balance Academy patient protocol. You'll be able to use this one for your patients for the sleep medicine part of your program. Now, if you have an exercise program, you might have another one, or a weight loss program. It doesn't matter. You can have as many of these as you want. And in each one, you can have the different tasks that you want your patients to perform. Stay away from In-Hand Health because generally what you see in there is a bunch of dental material. So In-Hand Health, you just don't need to access that. My dental colleagues, when I introduce this to my dentist, of course, they will probably use some of this, especially around Invisalign and clear aligner therapy for orthodontics. For now, though, I'm going to have just use this clinic section where I have these 2 different templates. Now, under the Sleep Balance Academy patient protocol, if I click on that, you can see that I have, let's go back here. Let's go back to clinic group, patient protocol. And I'm going to have a little bit of, just a little bit of work here to get this together. Yeah, coaching chiropractic. Okay. So we can add different kinds of things in here and prescriptions. And you can see down here under the prescriptions, you'll see the screening form that we want people to use. Okay. So that's And we can edit that right here and put different resources from the library into this area. So this is not a hard thing to use. I'm not as familiar with it as I want to be, but I'm getting there fairly quickly. So let's go back to my presentation. So I just showed you the laptop screen and and your desktop and laptop software. So let's take a look at the phone apps. The two phone apps that you'll see that you download from your app site are there's one white one and one blue one. These are called dental right now. Don't let that worry you. But the white one is the essentials or the admin button that has some of the same features in it as the desktop that you just saw. The patient one has only things in it that would pertain to a patient's reporting requirements to your office. Okay. So let's look at the white app and the first button that we looked at there on that screenshot, and you'll see the resources library. Now I'm going to call this Essentials 1, and in this resources area where they call Essentials, you have the resource button, the activities button, the message button, and the patient button. Okay, and you can see that I have library items within the resources here that I use to teach chiropractors and dentists how to implement their sleep program in their practices. And you can see there's a screening form here from Dr. Ali. There's two of them that I want you to fill out on patients. And then there's a circle ring initial setup instruction, a little video from me, a circle ring interpretation video that you can help you understand how to interpret the circle ring, and then the Medicaid or Medicare approval documents here. There's a few. There's about 10 to 12 of those, and they're quick and easy, help you to understand what you need to do with your patients as they go through your program. Now, I'm going to Essentials 2, which is the next one, activities. Instead of the resources, we're looking at the activities button, just like you saw on the desktop, that drop-down menu of libraries. Activities is another library that you use in your prescriptions, and you draw from that well for anything you want the patient to do. Now here I have one for patients, and here's one for the doctors that I'm going to be coaching, the one that you saw on the last screen. But the patient one, you can see that I can tell them how to put on the circle ring, and I have a little video on how to do that. I have a talk on the nasal aid and how to use that nasal dilator every night, to turn off their cell phones, to turn off their home router, how to use their Guard hypochlorous nasal spray. And there's other things about xylitol spray. So we have essential libraries that we can draw from. I might put some of these in over here for the doctor to have those as well, just because I want them to see what the patient's going to see. So that you draw from these two libraries for any of these particular tasks. Now the next one, Essentials 3, is that patient messenger board, and you can see there's two there's the patient and the clinical, and I can see my messages from a single patient here. I'm having a discourse with a patient, and if I want to, I've messaged them earlier this week or earlier today. My staff might be answering them. But if I want to have a talk with the patient, I can just click on the green button here and have a face-to-face conversation with the patient through a HIPAA-compliant portal, face-to-face interaction. Okay. And here's another one of the message board. And again, I can look at all the messages that week and just see kind of a summation of all the different activities that I've had with that patient. Now, one of the things I can do with my portal is I can upload documents like the circle ring report. And this is my circle ring report that I uploaded from a screenshot from my phone right into the portal. You can upload PDFs or any kind of file off your phone can be uploaded into the app on the phone. You can also have a virtual visit, as I mentioned before. And in the resources area for doctors, I can also have resources for ordering different equipment. For instance, you can order sleep image rings here, or sleep image study from our doctors. Telemedicine call from an MD. You can order night owls or sleep image rings, or whatever you want to order can be ordered on this light at the tip of your finger. And then I expanded one of those, and here's the night owl order site. And you just click on that, and it'll take you right to the place where you order more night owl sleep studies for your patients. And you can dispense those when you have them at a profit. Now let's look at the patient app. That's the blue app on the phone that I just showed you. And you can see on this app, I have a coaching for chiropractors and a coaching for patients. Now your patient won't see this, but I have it on my app because I'm also a patient and a coach. So I have both of these, and I can click on here and look for daily reporting to my coach about activities that they want me to do so that I can have a successful sleep practice. And down here, I have activities for the patient to do, and I can upload their circle ring results here or any other document here, and also their daily check-in every day. And let's see what those look like. Oh, and as status at a glance, I can tell how compliant you are by just looking at the color of these things. As the more green you get, the more compliant the patient is. The more red they are, the less compliant. And you can see over here, I can even look at myself, and look at my own stats, or my doctor can look at my stats. Okay. And here again is a picture of that laptop screen that I just showed you. But also, I wanted to show you this. I can look at, if this is Mrs. Jones and Mrs. Smith, I can see by the color whether they're compliant or not. If it's dark green, they're doing well. If they're red, they're doing very poorly, and that patient needs a call or some kind of communication through the portal, like a message that you send to them asking what's wrong and how can you help, and your staff can do that. Okay, so let's see a patient daily task reporter bar. And here you can see we have them using the xylitol nasal spray, the hypochlorous acid nasal spray, whether they use their nasal dilator and their circle ring that night, how many hours did they sleep, did they turn off their cell phone at night, and their CPAP use. And they just scroll this little button from left to right, indicating how many times they did. And whether they're being compliant or not will help me to see if they're getting towards the green. It encourages them, that encourages them to do that. So I'm asking them to do that 3 times a day, and this person did it 2. Here's the coach doctor daily task report. You can see all the tasks that I want the doctors to do. How many screening forms and circle rings did you sell? And nasal sprays did you sell? And hand portal and placements did you get people into? And sleep studies dispensed. And here's one that's just partially answered by a doctor. You can see they did the screening forms dispensed that day of 20. I'd like to see doctors do 20 or more. Okay, but I can tell you how you're performing by just having you scroll these buttons. It's pretty simple. This is the bottom of that form because I couldn't get it all on one screen. So just the same report. You can see it on here, outside referrals, there's 4 there. So the recommendation is 4 of those. So let's talk about this income. We're not just getting income from your recares coming in and patients being reactivated and treatment being needed, but you're actually going to be able to make an income from the telemedicine site itself by people subscribing to it in your practice. So let's talk about the cost of this medicine, this software. The software setup and orientation, $699. In-Hand Health will orient you and teach you how to use the software. The monthly subscription cost for their minimum package is 30 patients at $149 a month. At that cost, and 30 patients, you're going to need to bill $5 a month per person to break even. I suggest you double that and make $151 on that package each month. You might charge more than that. You may want to charge $20 a month. I don't know. The monthly subscription package for 100 patients is $250 from In-Hand Health. You'd need $2.50 per patient to break even. At $10, you make $750. And at 1,000 patients per month, the cost is lower and the profits are $10,000 a month at $10 per patient. Could be more, double that if you're at 20. Okay. So that's just your money, patients being on your telemedicine portal and having a monthly subscription. So my offers, I'm not selling this, I'm really not selling this individually. I'm selling it as part of the sleep, the screen, diagnose, and refer program. You could purchase it if you want to use it for other types of chiropractic services. And if you insist, I would let you, I would encourage you to purchase that. But right now, we're going to do this on the beta testers and the beta testers, and it's going to be included in the $5,000 package, which includes quite a bit of equipment, instruments, and products, and coaching from Shane Smith and myself. Here's the order link for that. And if you need to talk to me, call 563-590-1563. I think this is exciting. This is going to really help your program succeed. And it's going to be an addition to your practice in and of itself that is going to be extremely valuable. Thank you very much.